Have you ever experienced a nagging ache after a run, wondering if it is just muscle soreness or something more serious happening within your bones? A stress fracture is essentially a tiny crack or a severe bruise within the bone, often microscopic, caused by repetitive stress. In contrast, a full fracture is a complete break or discontinuity that goes through the entire structure of the bone. The core difference lies in their cause and severity. Stress fractures develop over time when the bone's repair process cannot keep up with the repeated impact and strain it endures. Think of it like bending a paperclip back and forth until it eventually breaks. A full fracture, however, typically results from a single, significant traumatic event or high-force impact that instantly overwhelms the bone's structural integrity. For you, the runner, this means listening carefully to your body's signals. Pain from a stress fracture often starts as a dull ache during or after activity, feeling better with rest, but gradually worsening over weeks if ignored. A full fracture usually causes immediate, intense pain, often with visible swelling, bruising, or an inability to bear weight. Knowing the type of pain helps you decide whether to rest and monitor, or seek immediate medical attention from a healthcare professional. Our bones are constantly undergoing a process called bone remodeling, where old bone tissue is removed and new bone tissue is laid down. This dynamic process, governed in part by principles like Wolff's Law, means bones adapt and strengthen in response to stress. However, when repetitive stress exceeds the rate of repair, especially in weight-bearing bones like those in your legs and feet, microtrauma accumulates and can lead to a stress fracture. Ignoring these early warning signs significantly increases the risk of it progressing into a more debilitating full fracture. Understanding these distinct differences empowers you to respond appropriately to bone pain. This knowledge can help you make informed decisions about when to pull back and rest, when to seek prompt medical advice, and how to protect your bone health, ultimately ensuring a safer and more sustainable running journey.